bringing all together to discuss on this important topic. The topic of the day, which has been given for this panel, is technology in tackling the pandemic or disaster management and the learnings for the administration. A very interesting subject because it talks about the pandemic situation, how technology has helped. Also, it talks about, more importantly, the learnings for the administration. We are all we have been humbled by the virus. We know that we do not know everything about it. So as we face the situation, as weeks progress by, we learned many things. So what we learned in the month of March, we are better off in the month of July. So while taking that learning forward, we need to share this with the world, share this with people who are connected with us today, so that the learning cycle need not be rediscovered again and again. So an excellent topic. We have a very good panel to discuss this. People whose the skin is in the game, so to speak. I would like to welcome the three panelists who have joined as of now. Dr. Rohit Bansal, he is advisor to the Agra Smart City Corporation, and he heads the COVID war room there. Uses technology and even SHG for Agra. So hearing from him would be a very good thing, not only for the listeners, also for us. We need to learn from each other. So sitting here in Odisha, Bhubaneswar, I would be able to know what is happening in Agra. I also welcome Dr. Garima Mittal. She is the CEO of Faridabad Smart City, one of the population-wise, one of the dense districts of Haryana, and has done some exemplary work on the ground. We have been reading all over the place about how Faridabad Smart City has been coming up over the last couple of years. So welcome you, Garimaji. I also welcome now Dr. Shafqat Khan, who is currently working as the officer on special duty in the Department of Health and Medical Education in Jammu and Kashmir Union Territory. He already has worked in as a commissioner in Srinagar Municipal Corporation, has strong experience in the e-gov platforms care. So we would listen from him about the role of IT in healthcare in the due course. We also, apart from the agencies and the administrations from the government side, is delighted to welcome Dr. Chinmay Hegde, who is the CEO and mentor of Astrikos Consulting. They are largely into data management, analytics, data sciences, and areas such as big data and data center management. Also, they have an excellent vertical on crisis response system. And as we know that we are not insulated from each other. In fact, government works with the private sector, the knowledge partners. They bring in the technology and we deploy it on the ground. So theoretically, the private sector, in fact, are the teachers, and we are at the forefront to use that tech and put it on the ground. So I welcome Dr. Hegde. I would start with I'll keep this discussion. So we have about an hour in total. I'll put a point of view from Odisha just to give a filler about the subject, and then I will seek each of you experience sharing for on this particular topic of COVID management and learnings from the administration. And from Astrikos, we would expect to know where all we can do more. So coming from the industries, you'll have a different perspective altogether for all of us. So where should we begin with? We begin with what is India? We have extremely good strengths, we know, in technology. Currently, all sports, in fact, sports have restarted about just last week. Being a sports fan, if you see cricket all over the world, wherever India goes, you don't feel India plays in any country as a guest. Every stadium becomes full of Indians, and largely it is because of the IT industries across the globe where we are present. We have innovated, we have made our presence felt almost in every country that we can think of. So we as a population are very strong in adoption of technology, in innovation. I'll give an example from my state. All of you would have heard about the Konark Temple, the Black Pagoda, the UNESCO site. Draws a lot of people from outside.
Manoj sir, your video and audio got stuck.
Direction from which the sun ray reflect on the wheel. You go to that wheel particularly, the shadow of each of the axis and sub-axis of the wheel will give you the time to the correctness of 3 minutes. So that is the ability and innovation that Indians had displayed way back in 10th, 11th century. So we are I don't think we are inferior to anyone. So when the epidemic has come and hit us, we have used ingenuity and we have used technology to combat it. In terms of the two sides of the municipalities directly, and we see for a change that the respect that each of these municipalities or government-run organizations like even Air India, the amount of work they have done to bring people back into the country, the respect that people have especially at the cutting edge, is tremendous.
I think Manoj sir is disconnected. Fahim, you want to inform him? Dr. Bansal, is it the same thing you are also experiencing, that I'm not able to see Manoj sir online?
Yeah, Chinmay.
Yes.
In fact, when that is my topic is more or less related with the pandemic, especially COVID, and as a war room, which we used especially ICCC. As Agra came in a smart city in 2016, and we have done this, our control and command center was completed last year. And we have taken that first priority is control and command center. You will not imagine that every participant politician were against. They said we should show the things which infrastructure manner we can see, especially bridges, gates like that. But we were behind that ICCC is the main component of this project. And fortunate part that we started as a smart city came in function just 6 months before. And after this pandemic, and everybody was behind the control and command center. First
Okay.
case was noticed in 2nd of March. The family shoe exporter, when they came back from Italy, all 6 family members got positive with COVID. And that was an initiation nobody was having even at the country
Can I get
level
any
also.
feedback? Is my voice through?
Yeah,
Yes, yes, yes.
Manoj sir, I think you were disconnected. Now it is better.
Yes, Manoj sir, your voice is audible to us.
Mr. Chinmay, am I audible now?
Yes, sir,
Now
yes,
you
sir.
are audible, sir. Actually, we can hear you.
Thank you so much. I these are the challenges that we have to cope with. The internet bandwidth has been a challenge. So I was talking about the renewed respect for government agencies that has come through in the epidemic time, and this is why we need to live up to that reputation.
Again, I think we
I
lost Manoj sir there.
I invite the speakers one by one. I may have the pleasure of inviting Dr. Rohit Bansal, who is the advisor to the Agra Smart City. We would like to know, Mr. Bansal, from you the interventions that Agra Smart City has done, especially during this COVID times, and how this has helped in combating the pandemic. Over to you, Mr. Bansal.
Certainly, sir. First, good afternoon to my colleagues, and thanks to Fahim and Raman. And after attending a last meeting in Goa, we were thinking a cap. But fortunate part is this: that Agra, as a smart city, when it came in second round, 2016, sir. And in 2016, we were having 23 projects, and the public or citizens or politicians were behind that we should start from the infrastructure manner, like we can build the gates and we can build the bridges and roads. But we were thinking control and command center is a major component which we can facilitate, and that in a better manner for all the projects. And so fortunately we could complete this control and command center in mid of 2019. And sir, again, unfortunate part, first patient I can say came in northern India, that was in Agra, sir. The family shoe exporter, they came back from Italy, and 2nd March, all 6 family members were reported positive. And there was a meeting in Commissioner House, and we were thinking how to manage that, and immediately took decision on 2nd March itself that we will use control and command center as a war room, sir. So every day, round the clock, commissioner, police department, municipal commissioner, and health officers, they were sitting under one roof. And from there, we were working 24/7. And we were facilitating in all the manner, whether it was district control, grocery helpline, security surveillance function, traffic monitoring, monitoring of lockdown, live telecast of advertisement through public address, and video conferences with the commissioner Lucknow. Everything was done from that room itself, sir. And secondly, when we thought that Janta Curfew was announced on 26th March, again we were having a target how to acknowledge these things and percolate at each and every public level, also citizen level. For that, sir, we are having a 600 cameras at 27th junction box, where we were displaying all the things what to do, do's and don'ts, and they were regularly giving the information ki you maintain a distance of at least 1.2 feet with each other. And if the person were not maintaining that distance, or they were coming in crowd, and this feed was directly going to concern police station, and police person were going there and they were solving the issue. And similarly, sir, suppose if somebody was violating that rule, immediately e-challan were raised, and 9,600 challan were raised, so that those people were having a fear that we are already captured, and earlier it was not done. And police was also having a fear that everything is captured, so that we cannot violate the thing, and they were doing everybody was doing their duties. And secondly, sir, major important part which I shared, this was the again a smart health center. That plays again major role. Every doctor was afraid that they can also have the positive, so that doctor were not treating a general patient of cough, cold, fever. No doctor was ready to see the patient. Then there was again challenge. We did again and again meetings continuously with the administration and doctors. Even then, doctor were having a fear. 25 doctor got positive from Agra, and then ultimately what we have done, we said to our smart health center, that is 10 centers in Agra, and they are doing the different diseases they are taking care. Like one is for dentistry part, second is for ultrasonography, just radiology part, I can say, one is for cardiac, another is for general disease. One center we are having in municipal corporation itself in that premises, sir. There, the one doctor is sitting. He's a MD medicine. This is really, I can say, e-doctor services. And the patient who were coming, and you will not imagine, sir, the public, or I can say the workers who were transferring from one city to second city, they were having a number and they were taking a advice. We, in fact, from a smart health center, gave a medication to again 11,000 people during these 2 months. An advantage was that the doctor was also not having a fear. Patient has to just detail all the things, and all the things were noticed and stored. And even then, patient want to talk to doctor, doctor were available over there, and doctor were giving the prescription. And through that prescription, he could send all the reports also to the doctor, and doctor could see that on the computer. And after seeing all the things, and doctor were giving the advice for these radiology checkups also, these were also done. So this was the basic advantage, and patient were getting the medicine also, because that dispensary were open 24 hours whole days, especially in a smart health center. And this is the another thing. Then we thought ki Sarve Santo Niramaya, in that ground we launched the Sarvam Setu app, and everyone think that we have to work together. And in this manner, apart from this, we also did the job related to distribution of food stuff. We created a food bank. Majority industrialists were ready to distribute the food, but again the problem was that if these industrialists distribute the food, again the jam will be there, crowd will be there, and distancing will not maintain. Then what we have done, sir, we have 100 watts in municipal corporation Agra, and we have selected 5 shopkeeper of grocery, 5 shopkeeper of vegetable, 5 shopkeeper of fruits, and we have given numbers, mobile number of those to every ward, and they could select and they could place the order through that number, and they were giving doorstep delivery. That was the advantage. And industries whosoever were interested to give the food to the needy people, that we talk through again control and command center, because all the thanas were attached, that they will give food to only police station. And we have fixed the time from police station everybody can collect the food. So that was the done and facilitated manner of proper food distribution with maintaining the social distance, food bank part. That was. Secondly, sir, again the containment zone, we have given the one registry for registered yourself, whether you may be positive or chances, or are you positive or asymptomatic. We have made one questionnaire that was of 10 questions, like temperature and comorbid disease, hypertension, etc. you are having or not, and temperature from how long. The person was sitting on that 10 questions answering, and they were sending to us, and we were compiling and sending to concerned CMO office. And they were realizing or just analyzing that the chances of this area, we should go for sample check or not. If the containment zone, we are thinking this is containment zone, or majority people are asymptomatic or positive, we were giving the feed to municipal corporation also. On that ground, they are giving the sanitization 2 times, 3 times. If there is a less chances, that sanitizations we were doing for 1 time. That was the proper usage of the resources which we were having because of limited resources. And similarly, that when we were thinking the chances of containment are more and high, then we were thinking we should what do that we lockdown time also we can increase or decrease, and the one side will open left side and alternate day we will open. These were the things we have done. And then we have used one more technology also, that was emerging button, sir. That what emerging button app in Sarvam Setu app, within that 300-meter ka radius mein, if any civil defense volunteer is there, we have taken the data and taken the consent from those volunteers. They are ready to help the civilian. Then we have given the number of those civilian, the civil defense person. that if anybody is requiring a help, the civil defense person will go and they will help them out. These were the things that we really enjoyed by using the technology and smart city and control and command center, smart health center. Yes. Anything else, sir?
It's
Manoj, sir.
extremely good hearing somebody speak so passionately about things that have been done at that level, at the ground level. In fact, I can't agree more about the initial days when it was seen that one person getting positive, the entire world was after them to find out
Yes.
who is he, who is his father, who is his mother, where he had gone to. Fortunately or unfortunately, with numbers rising, people's sensitivity to individual cases have declined. So doctors not wanting to treat and you introducing e-doctors is amazing. That's one of the great things that I could pick it up from your initial remarks. I think I'll welcome Sundar Balkrishnan, Special Secretary, IT, Electronics and Communication Andhra Pradesh, and also we have our young officer Nitin Singh. He is District Collector Almora. He had another meeting, but he has joined us after the meeting has got over. From here on, from after hearing the experience of Agra, I would like to bring in Dr. Garima Mittal here. The Faridabad experiences we have heard a lot in different media. How since it is close to Delhi, and Delhi being one of those red alert areas of the pandemic, how have you coped, and how have you been able to bring in innovation to combat the pandemic? Over to you, Dr. Garima.
Thank you, sir. Sir, at Faridabad, sir, when we started with the lockdown, sir, as rightly mentioned by Mr. Rohit Bansal, we also had used our ICCC as a war room and utilized it for the surveillance and for the lockdown monitoring. So that happened in three shifts, and it was working 24 into 7. And so that apart, sir, as in like in administration, we have our established systems. So what we understood over the time and the insights and the learnings were like this, that we can use the IT, but we should use it not to reinvent the system, but only to add value and advantage where it is possible. So, sir, we have tried to actually find out the niche areas where the technology actually added advantage to us. So we felt in the times of social distancing when our physical meetings were very constrained, our webinars, our e-meetings, they were a great platform for every one of us to have meetings. In fact, very large meetings with the ASHA workers, RWAs, and to disseminate information and the knowledge regarding what the municipal corporation wants to tell them regarding social distancing, mask, and other things like variable messaging signs, as they have been mentioned. So, sir, I think when everything went into a lockdown, our meetings and our trainings and our learnings, they never went into the lockdown. And this data platform, this e-technology, sir, it has helped us through webinars and the Zoom meetings, WebEx and Cisco. They have really helped us through these times, and we have continued with our field trainings also. So two important things which we learned, and they were very useful for us at Faridabad. They were like data portal management. There were always issues in the ICMR data portal and the state portal. And because we had the ICCC war room and very established analysts there, so sir, we were able to crunch the data real time and streamline it also, like with the Google spreadsheets. We ensure that our medical health institutions who actually go in the field, they fill the data once, and once that is filled, it's automatically filled in a final data sheet and it goes to the headquarters. So that helped us to remove the doubling which is very often being done in the government setup, and it helped us to bring some efficiency and element of smartness also. Secondly, sir, where we found that our technology really helped us was the bed management portal. As you rightly mentioned, we are very close to Delhi, and we actually foresaw that we will be actually landing up in a situation like Delhi. So we made our bed management portal very robust, and everyone in the ground, as in the incident commanders, SDMs, and the private hospitals, they were given the login ID, and they were entering how many beds have been created on the real-time basis, how many patients are admitted, how many discharged. So that is how the dashboard was very dynamic, and we were able to make decisions on basis of it. So, sir, these were the three things like the lockdown, the data management, and the bed management, where specifically it helped us. And lastly, sir, I like to mention the three more interventions that we did for the citizens. One was the telemedicine, and this telemedicine helpline was like anyone can give a call, even a illiterate person can make a phone call, and it goes into a pool where 100 doctors, qualified MBBS doctors are there, and whoever is available will pick up this call and respond to that patient. So, sir, it was very effective, and we were getting lots of hits even from the illiterate people. So, if anyone in the ICMR portal shows a positive report, we give them a call and give them this number. So, anytime they want a medical help, they can simply give a call on this helpline number and talk to a qualified medical doctor. So, sir, that was one intervention. And secondly, sir, it was seen that though there were less patients and more recovery, but then there were lots of psychological issues, and today in the stressful world, we thought about psychological counseling. So on the similar lines, we had a helpline which was launched. It was a simple phone number. You can go through the website URL also, but you can dial the number also, and you will have a group of psychologists who were voluntarily counseling the people. So, sir, this was also the second initiative that we did for the citizens. And thirdly, sir, for the home isolated people, we had a whole call center being designed who gives them a call every day and asks them about their fever, their pulse rate, how are they doing, what is their SpO2 value. So they rest assured that they have been taken care of, they have been getting calls, and we are also sure in case of any emergency, we are doing an early intervention, and maybe we are preventing some death somewhere. So, sir, to sum it up, I believe that a few of the interventions were at the administrative level, data management level, bed management level, lockdown level, and also the citizen phase of it was the telemedicine, psychological counseling, and also the home isolation that we gave the regular calls. Sir, thank you, sir.
Extremely well spoken, Dr. Garima. In fact, this is what is what we need to keep in mind is that IT is not technology only or the emerging technology only. So we very fondly we talk about AI, ML, blockchain. The they are products, but how we use them and where we use them is very very important. In fact, simple things like a number where people can call up, that IT is far more relevant to our society than having a AI based tool, which probably will not get utilized by people on the ground. So, whether it is a call center, whether it is a simple telemedicine where people can just call up the doctor and speak, these are also the IT interventions which are needs to be regarded as they have been very, very successful on the ground. Thank you so much, Garimaji. If Nitin Singh Bhadauria, the district collector, Almora, you can hear me? Nitin,
Sir, good morning.
you hear us?
Sir, good morning. Sir, actually, sir is just about to reach. He is in another meeting.
Okay. No problem. So you can just be here and no problems at all. I thought if he's free and joins, then we would have taken him up to hear from him. We have now. I will bring in Dr. Shafqat Khan from Jammu and Kashmir. He has been the OS, currently posted as OSD in the Department of Health and Medical Education. Has worked in the Srinagar municipal corporations. So when we are hearing, we have heard from Agra, we have heard from Faridabad. Let's hear about the healthcare interventions based on IT, which I think is the forte which Dr. Khan will be able to share with us. Over to you, Dr. Khan.
Thank you, Manoj sir. It's a pleasure being with this distinguished gathering of officials who have severe commitment and have contributed towards IT challenges in their respective states and fields. But I will lay whatever little emphasis I can about the e-governance initiatives we have taken vis-a-vis healthcare over the past couple of years. Uh, we had some projects which have stuck up in the past, but once the UT administration took charge and we started very aggressively pursuing our these backlog projects. Especially, we had this 102 108 GPS based ambulance system, which was pending almost from the last 8 years, and we rolled it out one and a half month back. Honorable LG, in fact, inaugurated the project, GPS based project, uh, uh, and it has been basically the baseline of our entire healthcare system because, as you know, J&K is a hilly state, and we have rough terrain. We have inaccessible areas where people don't have access to basic healthcare. Sometimes the patients have to be transported on physically by people, and this has actually been a large, huge step towards integrating the entire healthcare into the larger loop. Secondary, we recently launched the telemedicine project, which was also um, half it was initially implemented, but now we have added the hubs and the loop is larger. And we have taken our telemedicine project to the level of a PHC. We have border areas where access is cut off for almost 6 months, sometimes 4 to 6 months. That is the area of Gurez, Tangdar, some areas of Rajouri, Punch, Doda, Kishtwar belt. Uh, there, uh, suppose we had ECGs or X-ray plants installed, but we did not have qualified healthcare professionals ready to give the advice. So we have been able now to put in loop a system where an ECG is immediately sent across to various places across the state to specialists and super specialists who give an opinion within minutes of taking the ECG. And now the patients have started recuperating better. The chances of survival have become better. And we had, in the areas where there is cross LOC trauma patients, we have these, some skirmishes going on through the LOC. So there are a lot of people who get traumas, orthopedic traumas, and get injuries. So that is also taken care of. But I will certainly tell you a lacuna of our IT platform. I quote today's newspaper. We have daily Excel share, which comes from Jammu, and the front headline is Directorates autonomous bodies keeping IT department in dark over e-governance projects. See, I want to point out this, I think, happens in all states. The IT department and the semi-autonomous and the directorates of different departments are doing work in silos. They suppose make their own software, they develop their own websites, without consulting the IT department. And the IT department, we have the Jakeja, Jammu Kashmir E-Governance Agency, which is headed by our Principal Secretary to Honorable LG, Mr. Bipul Pathak sir. Pathak sir is the CEO of Jakeja also. So he, in fact, took these initiatives, and this news today is, in fact, a net result of that initiative, where he's trying to rope in all the departments, hand holding them, and putting them on the same platform. So I think we had starting in municipal corporations, we had started building permissions, online birth and death certificates, single line single system for other public these centric services. But we certainly will need to take them much further. IT departments of all states have to take a lead in doing it. This working in silos, in my opinion, is not a very healthy sign. We have to integrate it all from the level of the secretariat. The Secretary IT has to be the nodal officer. He should have an access to every and each autonomous, semi-autonomous, or a common department, whichever is doing any kind of IT work. So I think, sir, I understand we another problem since August 5 has been that we have not been able to get 4G services. We are still on 2G, but we have standalone Wi-Fi systems which BSNL is providing. Geo fiber is there now. We have private 2, 3 agencies which are giving home bases, based and office based internet connections. But nevertheless, I understand we had issues since the last 6 to 8 months, whereas Ayushman Bharat is concerned. Ayushman Bharat was a huge boom in J&K, and the number of cases enrolled and the beneficiaries was amongst the best 5 across the country. So Ayushman Bharat implementation has had us in the beginning of post August 5 a little setback, but later it got better because all the hospitals, the government sector and the private sector, their internet services were uh, released by the government. And Ayushman Bharat has also been one of the very good things which has happened to the people of the state. Now we are going to have a universal healthcare scheme, which Government of India has been very kind to help us here, and we are going to ensure all the citizens of the state, the employees. We had a private insurance for employees, government employees, but that went into hurdles and that was cancelled in between. But now we are integrating the Ayushman Bharat along with this universal healthcare scheme, wherein all the employees of the state, along with other groups of people, will be insured from the healthcare perspective, and at a very nominal premium of around 600 to 700 rupees. So I think those are the larger things which we have done. Several departments, tourism department, other departments have done a lot of work in the IT sector in J&K also. But again, I will have to put it here because I have personally seen this, that there is a lot of need for integration of the IT secretariat and the departments. The coordination at various level is missing, and I think we will have to strengthen that.
Thank you, Dr. Khan. In fact, you have touched upon the most crucial aspect, the relevance of IT and how deep it goes in the governance system. As Secretary IT, I can tell you my experience. I have been interacting with my colleagues, most of them senior colleagues from Andhra, Maharashtra, Karnataka, and I'll tell you that this country is a country of countries. So each state is at different level of progress in terms of adoption of IT, and we understand completely how difficult it is for the Union Territory of Jammu Kashmir, mainly on account of the penetration of 4G availability and fiberization of the Union Territory. Be it as it may, the silver lining of pandemic has been the IT sector. In fact, when the highways were closed, the railways were closed, the airways were closed, the only thing which was on was the information highway, and we all the night ball was lit by the IT department and the IT industry ecosystem entirely for the nation. And I frankly I think for the first time, since I also do the same thing, we break our head with other departments to tell them that how they it will benefit if they do adopt IT in their each of the schemes. Cut earlier to pandemic and after post pandemic, the role of IT as was being viewed by other departments have tremendously changed in favor of IT department. Earlier, we were considered to be the jewelry of the department. If there is lack of money, the first thing which will cut out is IT. So don't buy more computers, don't buy this, don't get system integrators to do all that. So those were not looked at. IT was not looked at as the core activity. It was more like jewelry. It will deck up the whole thing. It will showcase better, but never considered to be the core. But now with this epidemic, how we have dealt with it, the the capability to absorb IT has tremendously increased in each department, including the health department, which probably in many states is one of the last department to adopt IT. Ayushman Bharat has changed a lot, and the way forward is only brighter. So I
Sir, I
think,
sir, I want to share a little bit more about the post-August 5 scenario, when our entire physical newspapers, physical flow of information was not available, and once the internet got released, uh, newspapers were there. Now school children are having education through IT platform. Over the past, sir, 1 decade, I have always understood, and it was always my opinion, that until and unless you don't revolutionize IT in India, you cannot expect a transparent, you cannot expect a good governance at all. I mean, e-officer in secretariat, few departments, it was because of the efforts of few secretaries. Suppose we have one secretary for irrigation and flood control. He, in fact, unfortunately turned COVID positive a week back. He did a lot of initiatives. He was district magistrate Jammu. He did entire e-office for Jammu magistrate, district magistrate office. Now he was heading this irrigation flood control department. He has revolutionized our home secretary's office. Also has e-office. So we have been telling all departments, sir, because I myself went for the CIO training through Government of India Information Technology Department. We are 4 CIOs in J&K, including me. So we had laid so many thrust that let us start from e-offices for everywhere. Then you go to revolutionizing your revenue records, your healthcare transcription of medical records, uh, linking with Ayushman Bharat. But sir, I think that IT will be the backbone of good governance for India. If we are able to completely do e-governance at all levels, nothing is going to beat us.
see, I keep telling that IT, for the sake of IT, is never going to go very far. When IT is merged with a purpose, then it goes very far. So you require in each state, all that we require are some flagship programs where which will catalyze the entire environment in terms of IT. I can give you an example of there's a program that we started called Kalia. That is basically money transfer to the farmers. We started about a year and a half back before the central government did, and since it is an agrarian state, the state of Odisha, the money that was to be put into the scheme was huge. So when huge money was involved, so naturally everybody wanted to do it a DBT, it should be Aadhaar enabled and all of that. So such schemes, when it comes up, then you successfully deploy IT and do that in one click of a button. We gave 12,000 crores on that first day. I still remember when the honorable CM did that. That changed the outlook of each department. Then they started saying how much we can save by putting in IT and not do policing. Otherwise, in each scheme you go into, there will be 20%, 30% the fund going into areas where you do not have control. So the control and the efficiency both can come through by adoption of technology, and the national framework which has started, which is Aadhaar, Jamdhan account, the JAM framework. This has now made it very easy for each of the scheme to come up, be transparent, and the control mechanisms to be stronger. So I think IT is going to play a greater and greater role, as Dr. Khan said. I'm quite positive that this is the way forward that we are taking. I think with this I will invite Sri Sundar Balkrishna, Special Secretary, Information Technology, Electronics and Communication in Government of Andhra Pradesh. He will be my colleague because Andhra is my bordering state. Is known in the country as one of those states which has been way ahead in terms of IT compared to other states, and the state which has given, I think, 4 secretaries of IT in Government of India continuously. So we have learned a lot from our good neighbors, the Andhra, and he, as Special Secretary, also holds charge of Director General in the International Institute of Digital Technology in Tirupati. Also is the Commissioner Electronic Services, which is the eGov parallel in Andhra. From Tirupati, I have a very interesting anecdote I would like to just tell before I invite Sundarji to speak about. We had a tie-up with IIT Tirupati, the IT department of Odisha, and we brought in IIT Tirupati has in turn had a tie-up with Facebook India. So what we did when we were defining the municipalities will understand this better. We have a GIS based environment for the smart cities, and on that today we know that Facebook is more democratically available than water and petrol in the country. What they did was they used a technology with association of Facebook, is that any Facebook enabled device, when it moves, that can be tracked. So when we define the containment zones within the cities, all that we needed to see is that what is the movement, and it is evenly distributed Facebook. We cannot say that today the people who are lower income do not have Facebook. That is not the case at all. In fact, Facebook is available even on Jio phones today. So we monitored people's movement and activities in the containment areas from movement of Facebook enabled devices, and it was eye opening. We did it in Bhubaneswar, we did it in Raurkela, 2 of our smart cities, and we could understand that in which area, which containment area, probably the enforcement is not strong. That is why movements are higher than normal times. Even we could see we had the night curfew, so we could compare the daytime movement to nighttime movement to understand what is the level of fall in the night time. If it is not satisfactory, you can always tell the enforcement agencies, whether the municipal corporations or the police, and do a little bit of more enforcement to implement that. So this is what we had done with IIT Tirupati. So since you are part of that, I thought I'll give this story from Odisha. I welcome Sundarji, and the entire all of us would like to hear about the technologies that you have deployed in tackling the pandemic, and what has been your experiences, what are the learnings. Over to you. You have to unmute yourself.
Thank you very much, sir, and good afternoon to everybody. And I'm thankful to governors now for giving me this opportunity. And thanks for the wonderful introduction, Mishra sir. For yes, we do stand on the shoulder of giants in Andhra Pradesh. The topic, when it was assigned to me, role of technology for disaster and pandemic management, and I started learning about these issues. One thing which struck me was the amount of people and the resources damage that has been happening recently due to disasters as such. Forgetting about the pandemic which we are immersed right now, we may look at data from 2017. It was astonishing to see that 1.4 billion people have died, have been affected. 0.7 million have lost lives due to natural disasters management, and the amount of loss is estimated at $1.7 trillion from 2007 to 2018. This is the data I'm talking about. And when we questioned ourselves whether technology is helping us in averting or mitigating disasters and pandemic, the answer was quite mixed. Like I was hearing about the Surat experience, the Agra experience, the Jammu and Kashmir experience, and the Faridabad experience. We too, just like Mishra Saab had just pointed out, we started from the IT department, helping our sister departments in IT initiatives. The first, of course, was the health department, where we helped them build dashboards and mobile apps, mainly for monitoring the quarantine patients. The next, of course, was the revenue department, where we helped them develop heat maps because that is required for tracking the contacts. Then we also spread our tentacles to real-time governance, where we started with the concept of e-passes. This is an end-to-end application to enable movement of goods and passengers when the lockdown was in force. Then we had a interaction with the agriculture department, then with the food and civil supplies department, mainly to ensure that people who are under lockdown have access to groceries and whatever they require without without physically going to the stores. Then we also had a telemedicine tie-up to ensure that patients and doctors interacted without physical contact. What all were we doing? We were just nitpicking here and there in the face of a dangerous pandemic like corona. And when we really look at whether technology has really aided us, another interesting answer came up. 140, the doctors here will really support me on this. 140 possible vaccines for corona is presently being it is being enforced, and it was astonishing to me also that from 2002 onwards, our fight for a corona vaccine has been the effort is being made. 2002 we had the coronavirus one. 2015 we had the Middle East again due to another variant of corona, and now we have COVID 2. And 17 years of experience, and what has technology brought us with all its artificial intelligence, deep learning, IoT? What are we have got? 140 vaccines which are on trial, and only 19 have moved into human trials, and 3 has gone into human trial too. And as far as trial 3 is concerned, we have nothing to show. That means technology has helped us in only secondary activities, whereas the love that is in the science, we are faltering. When we study pharmaceutical economics, the average time period for bringing a drug is 17 years. This has been the time period since the last 75 years. So whatever technology we have been doing, whatever science and development we have been doing, we have not been able to shorten the vaccine and the drug buildup. So that means our efforts into technology, though has been very good in all the recent initiatives which our learned friends have been telling us, in the issue that matters, that is getting a vaccine for a very dangerous disease like corona, we have been faltering as we have been faltering back 75 years ago. Another interesting fact also came up during my study for this particular webinar. In 2017, we had the gross output from all the high-end technologies like AI, like ML, industrial IoT. I do run courses in the International Institute of Digital Technologies. I also teach there. Manoj Mishra sir had already alluded to it. 2017, the output, the value of goods and services, that is GDP of these technologies was 4%. And coming to 2019, the value of goods and services of these firms is something like it has tripled to something like 12 to 12.5%. And when we look at coronavirus, post-coronavirus GDP, our GDP total cake has shrunk down. That means total manufacturing, total goods, total output, total services that really matter to the people have come down, and the value added by these high-end firms has tripled. That means lot of money which the government has been wanting to spend for the bottom of the pyramid. Somehow, due to these technologies, this is of course a. I'm sorry to point out this negative feature of technology dependence on by the government. This has somehow enlarged the pie for the IT and the ITES sector, being from the sector myself. So what did we do to this, Andhra Pradesh? We woke up just 6 months back. We got a GO issued from the CMO itself that without technical concurrence, there shall not be financial concurrence. And armed with this important GO from the CM Secretariat, we started with the task of uh, drawing standards for all the software services that are to be developed in the state, starting with basic coding, starting with the apps are coming out by the dozen. That we from the CMO, somebody tells an app has to be developed for this, for that. No testing happens, no isolation in the production environment happens, nothing which is followed as a textbook procedure in the private sector. None of this is happening in the government sector. Again, we question ourselves why this is happening. When we look at the syllabi of Labasna, when we look at the syllabus of Police Academy, when we look at the syllabus of Forest Academy and other account services, what we are having is a 1.5 or a 2 year dose to the probationers and some 10 to 12 sessions on data sciences and things like that. But look at the giants in artificial intelligence. We have top people from MIT, top people from Carnegie Mellon, top men from Stanford, who have spent dozens and dozens of years in mathematics, statistics, and computer science. And they are the persons who are driving these technologies from the private sector. And here, sitting in the secretariat, we are poorly equipped bureaucrats, knowledge-wise, and not able to understand the technologies in work. So to plug this gap from the government side, we have been trying to develop our knowledge base in Andhra Pradesh first, develop a set of standards, and just last month we issued a complete set of standards, at least for the basic software development, for website, for mobile app. Some of it is already there with the government of India, but we took it and tweaked it and issued it in the form of a GUI, in the form of a matrix, so that all the IT vendors face a common matrix and the pricing and the costing at least comes to some rational levels. So, what is the conclusion? The topic technology in tackling pandemic and disasters, yes, it has definitely helped us. But if we add science to the topic, we are there in a stationary manner as we were 7 decades ago. And what do we have to do about this is something which we have to seriously question ourselves. So, with these concluding remarks, I now hand over the stage to Manoj sir for taking this discussion forward. Thank you, sir.
Thank you, Pradesh. Thank you so much. It's almost like the panel has completed one loop when Dr. Khan had put forth the issues, and you have explained how they have been resolved, how the IT department has been made as the vetting department for technology. So this is how it has to be dealt. In fact, we have taken a cue from Andhra, and we have done this in Odisha in last 1 year. Every technology solution that is being proposed by any department will have to go through the IT department for a technology vetting and then goes to the finance department. So this is how we have to go forward. I think with this we have a small video to play for all of us to see as and the participants and viewers. I request that video be played right now. I think we had our brief editorial. We have to thank all the sponsors who have made this knowledge sharing possible. In the end, I would like to bring in Dr. Chinmay Hegde, who is the mentor and CEO of Astrikos Consulting. As the panel is laden with people from the government, it is very wiser to hear from the private sector. I would like to hear on three things that gives us an introspection of some kind. That where do you think the enablers and the blockers are in government, and in the current situation in the pandemic, how you have seen the governments adopting technology, and thirdly, what are the new things that are available right now in terms of data science and disaster responses, which possibly will be of greater use to all of us who are here. Dr. Chinmay.
Thank you, Manoj sir, for
We
I think so. Chinmay, your mic is mute.
Oh, I think by mistake, I think somebody muted that, I believe. Is
it's
it okay
okay
now?
now. Yeah.
Okay. So I repeat, thanks for enlightening me about, or at the same time, audience about the respective efforts that you people have been putting in your respective cities to control this pandemic situation. And Manoj sir, I would want to address your second question. That is from the citizens' perspective as well as the private sector perspective, right? I'm quite impressed that how the especially the administration machinery has responded to this situation, even though there were a lot of lacking in terms of preparedness or expectations or the proactive information gathering. Of course, this is a global challenge, like we call all the developed countries themselves are failing in terms of controlling this, but thanks to Indian administration machinery, government bureaucracy, I could say that, if I can say that word, right, is has fantastically worked in terms of controlling. And India is, like I said in earlier sessions also, that India is not easy. It is having high amount of population, which is like now maybe we are crossing China in some coming few years. At the same time, density is uncontrollable, right? So that even though whatever the kind of a technologies that may come into India, challenges will still exist, right? So that is the reason I want to thank all of you guys, all of you people, right? So who are on this panel in terms of participating and helping out the citizens, right? So that's the my answer to your second question. However, uh, adaptability to technology during this pandemic has been very quick. That is what is as part of my personal experience, where we are involved in 4 different smart cities in India right now, also non-smart cities also, right, who are not part of the smart city mission, other ULBs or RLBs also. They have been showing immense amount of interest in technology, uh, adopting the technology to fight the pandemics and all other related area. And one of the thing I would want to make a clear mention that, when I was in discussion last month with the Aligarh Smart Cities honorable CEO, he was quite categorically anticipating a lot of things, that okay, right now I have this COVID situation, but every year I have many other situations such as H1N1 spreading or dengue spreading and all such kind of things, right? Why don't we look in terms of something like a platform that can be managing all the various different epidemics, or it gives administrator the total proactiveness in terms of responding to the issues and responding to the challenges of the situation, because it's a simple thing to crisis to keh ke nahi aata hai, right? That's why it is called crisis. So that is the thing, but more and more we are prepared then it is easier for us to tackle this things. That is what is the agenda I am seeing here. And Manoj sir, you are from from the administration cadre of Odisha state, and I don't need to tell you that what other type of disasters or natural disasters occur every year. One or the other flood or cyclone, right, impacts unfortunately to the Odisha state, right? So that is the thing. And each of you, I am seriously telling, and Dr. Shafqat comes from Jammu and Kashmir, which is having a lot of issues such as climatic conditions are quite erratic out there during majority part of the year. And similarly, like Dr. Garima or Dr. Rohit, they are from the area which is having high amount of tourist attraction, and then the spread is quite, spread can go quite uncontrollable. So this is the reason what we have envisaged in these kind of scenarios is especially is bringing a kind of a preparedness in terms of technological enablement, right? So we have data, everybody has data, and now after this pandemic, lot of global technological companies have started and coming forward and started investing in India, right? So all these kind of things are really should, all these things of kinds should be looked at real upcoming opportunities. And of course use this as IT has been the supporting function, fair enough, but now IT can drive a lot of things, right? So it is not only IT, it is information communication technology overall. We have to leverage based on that as a platform. And in India, any corner of the country, if you go, everybody uses WhatsApp, right? So that's the thing, Facebook or such kind of a things. And we have intelligent people, no doubts about it, right? So we can leverage this particular technology. And we have been involved in one of the cases that in Karnataka, which is a bordering state, like the situation of I'm talking about Belagavi district as a whole, where we are also part of them. The machinery has worked splendidly, because you must be aware that Karnataka's numbers are spiking up now, but Belagavi is still at 600 overall as a district. Even though the next is like they had a challenge of Maharashtra being immediately next hotspot to them, but the government machineries have worked exceptionally very well. So I hope I answered Manoj sir's question in that.
I think with this, we have stuck to the time. We have taken about 1 hour. All of us have participated. I personally have learned a lot from both the smart cities, Agra as well as Faridabad, talking about key initiatives at the ground level, because they are the people whose skin is in the game. We at our level, maybe we are doing the policies, we are giving a direction, but at the ground level, whether it is municipalities or the collectorates or the smart cities, their skin is in the game, and they are doing wonderfully well. I think with this we conclude the session, and we will vow that we will be able to defeat this virus, and we shall overcome. Thank you so much for being here. Now over to Fahim. I think we have concluded the session.
Yes, thank you. It was quite interesting and interactive session from the viewpoint of like how Agra has been tackling situation, or the kind of technology which Faridabad smart city has deployed in handling this pandemic. And from perspective of Sundar sir, from Shafqat sir, right, and then the industry perspective by Dr. Chinmay. Right. So it was, I think so, it was quite interesting and interactive for everyone and for our audience. So it's like I would like to thank you all for being a part of this. And it's like I look forward to it's like be connected with you all in our future conclaves also. Thank you, everyone.
Thank you.
Thank you.